Dr. Drucker, could you talk about, you are a physician scientist, right? And a lot of our experience is with failure. What did it feel like to have such a massive success?
Well, I'll tell you about a day in clinic. It was about 8 months into our clinical trial. This was before we had started the trial in children. The patients that I was taking care of were people that were told, you have 3 to 6 months to live, get your affairs in order. They found our way to the clinical trial. They were all responding. They were feeling great. And I was looking at this and thinking, this is amazing, but what if this doesn't last? Medication that temporarily improves their condition, and then 3 months later, they're right back to where they were before. Who's going to care? But they came to clinic that day, and 3 patients in a row told me about how their hope for the future had been restored. They were feeling better than they had in years. Their blood counts were normal for the first time in years, and they're thinking about the future again. And they were in tears. I was in tears, and I recognize that if they're embracing this, I need to embrace it too. And those same patients, like Mary, are still with me 25 years later. And I've seen their weddings, I've seen their children, I've seen their kids graduate from college and get married, and they are now grandparents or great grandparents. And then we set up the pediatric trial, and here we are 25 years later, and we're seeing the children of the children that we put in those trials.